Hello and welcome to Catamount Community Connection, our weekly public affairs program here at Catamount Radio. I'm Brian Collamore, your host, and each week we speak with leaders from the business, professional, nonprofit, and political arenas. And the goal of the program is to inform and make our listeners aware of things that are going on, not just in Rutland County, but throughout the state, things that will affect everyone listening in some cases. Some of the concluded enactment of laws, for instance, some of which will take place on July 1st, some of which on passage will affect people. And so we like to, inform people and make them aware of what's going on. Our program is brought to you by the Rutland County Agricultural Society, which has brought you the Vermont State Fair at Rutland since 1846. And we're already looking forward to the 179th Fair, which is coming up August 12th through the 16th not downtown Rutland, it's at the Vermont Fairgrounds, for heaven's sakes. And we're looking forward to that. Very well attended last year. And we're happy that things are hopefully on the upswing with folks at the fair. Joining us today, Peg Bolgioni. We've had Peg on in the past from AHEC, and also Dr. Megan Gunn, who's a pediatrician with the Red Clover Pediatrics offices in North Bennington. And welcome to you both. It's a pleasure to have you join us today. I know that this coming week, March 24th through 28th, Peg, is National AHEC Week. And forgive me if I don't remember everything there is to know about AHEC, but that's why I've got you back on, because you can remind me about some of the things that AHEC does. And hopefully it'll be a big week for you. And then we'll have Megan join us from time to time and talk about, I understand you have a very interesting story about how you got involved with this nonprofit as a high school student. So Peg, welcome in.
Thanks, Brian. It's great to be back.
Yeah. So tell us again about AHEC. What is AHEC? How does it affect people? All that kind of stuff.
Okay. Well, first of all, AHECs stand for Area Health Education Centers. And people often say to me, well, what is it? Okay, what do you do? Well, I guess in a nutshell, I look at AHECs as an intersection of healthcare, education, and community development. By establishing strong partnerships with academia and communities, AHEC helps to recruit, train, and sustain a highly qualified health workforce to deliver top-notch, accessible care for everyone, especially to those living in rural and underserved communities. AHECs were established in 1971, and our AHEC, the one that I represent, Southern Vermont AHEC, began in 1999, so we just finished our 25th anniversary. But anyway, getting back to when AHECs were established, it was through congressional legislation. They were conceived as a mechanism to recruit, train, and retain a health professions workforce dedicated to providing care for underserved populations, especially in rural and urban communities. And this led to the formation of AHEC regional centers throughout the United States. And actually, we are in 44 states and several U.S. territories currently. And there's a Vermont AHEC, that's us. We're a statewide network. And our partners include UVM, Larner College of Medicine, Northern Vermont AHEC, our counterpart in St. Johnsbury, and of course, Southern Vermont AHEC. Our offices are based in Springfield. I work in Rutland remotely, as does our executive director, Jennifer Scott, and Amanda Richardson, who is our director of health careers exploration. And so we have been working together all these years to create pathways for students to get involved in health careers and hopefully take that to the next level, to become professionals and to work in the communities that they serve. And the bottom line is to make healthcare accessible by all by having a top-notch workforce to do that.
What are some of the occupations that we're talking about with healthcare?
Well, in terms of what the demand is right now,
or just choices
just in general?
that folks would have growing up.
Well, the answer is huge, but you can start with the obvious: nurses, doctors, nurse practitioners, physician assistants, lab techs, med techs, oral health professionals like dentists, dental hygienists, physical therapists, occupational therapists, behavioral health specialists, huge need for them. The list is endless, but I think what's important, I think, to know is AHECs are trying to create innovative, interesting programs so kids know they have all kinds of options around healthcare. It's not just the standard ones I talk about, but there's so many more choices for them. And so that's why we create these programs to bring that to their attention.
You know, we had Lyle Jepson on, he's been on more than once, does fantastic work with the Rutland, used to be...
the Chamber,
yeah,
CEDAR.
Yeah, exactly. The Chamber of Economic Development of the Rutland region, for those of you that love acronyms. Mm-hmm. And we talked about a skills event that's coming up at Castleton University. I think it is in April, but the date exactly escaping me at the moment. Mm-hmm. But a lot of times they work specifically, and not necessarily primarily, but heavy involvement with tech centers. And so, for instance, and I know you're very well attuned to that because of your past employment. Mm-hmm. Stafford Technical Center, and then to the North Hannaford in Middlebury. And those are the folks that, for the most part, for a long time, it's been sophomores, juniors, and seniors that were targeted as sort of a potential for giving kids choices. But I'm really happy to hear when we had him on I think it was last month now, we're talking now about 6th, 7th, and 8th grade students being exposed to the trades. And, you know, for the most part, we're talking about electricians and construction type folks. But I'm wondering where the connection is with AHEC, with how far down do you go in terms of the grade that the kids are in school?
Well, we have gone into the middle schools.
Okay.
That's where we started. And as I said before, Amanda Richardson, who's our Director of Health Careers Exploration, she has kind of a roadshow that she takes with her to different schools in our particular catchment area. So just to clarify, even though AHEC is statewide, the area that we cover, the counties, are Rutland, Bennington, Windham, Windsor, and Addison County. So again, Amanda goes into the schools. She has a kind of a prescribed program, but you know, she can be very innovative and creative, and that's what you have to be with kids to engage their attention. And so that's really where she's starting. She goes to a lot of career fairs too, mm-hmm. At college level and the high school level, and she does a lot of visits to the tech centers as well as to the middle schools and high schools in our region. But yes. The long-winded answer is yes, we do start in middle school. Okay. Yeah.
I know for a long time we've talked about visiting nurses who, come into the state from other places and
travelers.
Travelers, yeah, we call them traveling nurses. Mm-hmm. They get a very good wage, by the way. Yeah. And I don't know whether we're still Rutland Regional Medical. I know is very tied in with that, because without them, they won't have enough nurses to provide the coverage they need to. So I didn't know whether that was sort of like when you go into a school, and maybe Amanda can tell you, what's the most popular job that everybody's kind of looking at? And is it because of salary, or do some people just sort of have a natural affinity for certain types of healthcare occupations?
Well, I mean, that's a great question. What a lot of students are interested in is EMT careers. Interesting. They find that very exciting and stimulating, and of course, I think they see a lot of this on television. The search and rescue, search and recover, and so that has piqued a lot of student interest. A lot of students too are interested in physical therapy around athletic training. That's another career track that seems to have emerged as something that's very popular. I think a lot of kids relate to that because many of them play sports. And, if you get injured, then there's the whole recovery process. How do you get back on your feet? So we've had students express interest in that. One of the things that's coming up, Brian, I wanted to put a little plug in is we're partners with the Governor's Institute of Vermont. Mm-hmm. I think I mentioned that the last time I was in. And this summer, we're doing our second Health and Medicine Institute. Actually, there's two of them that are going on. Our counterparts in the north, are going to be doing one July 6th through the 12th at Vermont State University in Linden. And then we're doing one down here in the South, July 13th through the 19th over at Castleton. And those are amazing, amazing programs. Students really have a chance to come in and do a real deep dive on what it's, all kinds of health science and research and medicine. And they're taught by, faculty members at Castleton, and they're also engaged with Larner College of Medicine. They act as student mentors. So they're on site as well. And the kids do all kinds of stuff. This year, our particular programs are going to focus on primary care and prevention. And students are going to have a chance to earn credentials in CPR, stop the bleed, first aid, and they're also going to have an option to complete their VEFR certificate, which is for Vermont Emergency First Responder. And they're also going to be doing a teen mental health first aid certification at Castleton. So that'll be the first of its kind. So, we get a lot of, the curriculum is very intense, very hands-on. There's a lot of simulations that the students do. They even have it's escaping me now, but they do like a disaster recreation. Mm-hmm. So if there's like an active shooter, or if there's some kind of a disaster on site, then the kids have to go through the whole thing of, taking care of casualties and getting people settled down, and that's pretty intense for kids in high school to do that. But they get through it. They love it. It's very popular.
I often wonder, when you and I were growing up, there's a program, I think it's on CBS every week, it starts with Chicago. So there's Chicago Med, then there's Chicago Fire, and then there's Chicago Police, or
right.
PD. And I often wonder, when the kids watch, and I assume the kids are watching that too, the Med, there's an interesting cast of characters who seem to really capture the spirit, I think, of healthcare. There's an older guy who is pretty much like a psychologist type, and he just kind of wanders around the hospital and helps people out with their mental condition, which I find really, really interesting. Mm-hmm. And I'm sure there's a great demand for that type of occupation and people to go into that. So we'll mention that again, the second medical event, or the medical event at Castleton, July 13th through the 19th, as part of the Governor's Institute of Vermont. And I don't know whether this would be a good time to bring Megan in, or...
Sure. Just to give you a little background, Megan is on our board of directors for Southern Vermont AHEC, too. Yep. And I'm going to let her finish her story. I don't want to take away too much, but I just wanted to kind of give that preamble that she is an integral part of our organization.
Well, Megan, welcome in. So tell us your story. You were in high school and somehow got interested in a career at, you're into pediatrics now, but tell us the story of how you got into this.
He actually got sick himself when I was young, and so I got to see that side of it and go through that journey, and that really kind of thrust me forward to want to go through with some sort of field in medicine, and here I ended up. How I got involved with Southern Vermont AHEC, I believe, so it was a while ago, you have to remember that, but I believe they came to Rutland High School where I went, and they learned about them at some sort of event. I can't remember exactly what, again, a long time ago. And then I really got involved in the first year of med school, so the summer between first and second year of med school, where I went at University of Vermont. You have the summer off, and I became a counselor for what is called the MedQuest program. That was my first involvement. And then from there, I also received Vermont educational loan repayment through Southern Vermont AHEC, which also has been really helpful to be able to come back and practice here in Vermont the way I wanted. And then I got asked to be part of the board, and I've been on the board, I think, 5 years. I can't remember exactly. Peg might know.
She's looking at me, so I don't know. Do you know how long Megan's been on the board?
I think it predated me. I've been with AHEC for over 3 years, and I believe, Megan, you were on the board when I joined AHEC.
Sure, those were busy years, so somewhere in there. And now I serve as the secretary, and getting more involved by doing things like this. And I just love to talk about all the things that Southern Vermont AHEC has to offer.
And you went where to med school?
University of Vermont.
Okay. And you're into pediatrics now. Why did you sort of, if you care to join us or to relay that to us, not sort of a general practice, but you got hooked on kids at some point too, correct?
Yeah. You go through med school, and in your third year, you do a lot of different rotations. You kind of get a little taste of everything. And I actually did my rotation with my old pediatric office in Rutland, which was really cool. And it was really, I liked everything, but it was the one thing I really loved. I really loved working with kids, and it kind of just fell into place from there.
Okay. Well, that's very interesting, I think. I can imagine being in the rotation at a medical facility. Some folks really gravitate, I guess, toward ED work, emergency department work. Others are surgeons, if you will. Others, as Peg has mentioned, we need techs as well in every department, whether that's X-ray or operational techs. And so it's a great thing that we have. And are you going to be joining the event in July over at Castleton?
I hope to be able to be there for at least a day. I hope to take a visit. I'm not deeply involved in the program, but I hope to be able to be there definitely. And when you mentioned all the different health careers, it's interesting because I'm probably not now still learning, but as I was a physician, I was still learning about all these different careers. And looking back, I'm like, oh, I would have liked to try that or liked to try that. And I love what I do now, but it's just so interesting to learn about. And I think the way that Southern Vermont AHEC introduces those to students even as young as middle school is really amazing, because you don't know unless you know, So I think it's been really great to be able to start kids learning about all these careers from a young age.
Yeah. No, it
and
really...
Hopefully
Go ahead.
They want to stay in Vermont, too. That was the last little plug there, because as probably everyone's experienced, especially finding primary care in Vermont can be difficult. So I think kind of training kids and students that are located here make it easier for them to stay here and then practice with us.
And much like a lot of other occupations, the further upstream you can intervene with people, especially with primary care, and we find the same sort of situation with agriculture, and I'm on the Senate Agriculture Committee, and so we work often with farmers about the phosphorus issue, the water that's going into the Lake Champlain watershed. And if you can treat that situation farther upstream, no pun intended, you have much better results. So in your case, Megan, I'm guessing that the earlier you can become involved with someone, especially on the primary care level, in other words, you get intervention early and you avoid serious complications that could develop later if that early care is not provided. Oh,
absolutely. And I mean, I think being a pediatrician, this is just a part of who we are, but helping, so kids are also on that vein, kids are kind of part of that pipeline. And so I think that's where we need to be putting focus. They're the future. And then, like you said, also kind of preventing any problems from the beginning is really helpful. That's why we recommend kids go to their well checks and things like that. It's not just about, giving them vaccines and weighing and measuring them. There's really a lot of other things that we're identifying and trying to intervene with to keep them healthy during those visits.
Yeah, and it's true, of course, with everything. Things change almost daily, it seems like. You're doing medical procedures now that weren't even thought of probably 50 or 100 years ago. We went, when I was growing up, I'm 74, so we got vaccinated against mumps and measles and chickenpox, and I had all three of them, even though I got vaccinated against them. But the symptoms were much less pronounced, I think, in each of those cases. But I can distinctly remember, having swollen glands in my face and the little pock marks on your skin from measles. Or no, from chickenpox. I'm not sure what the measles do. I guess there's another concern, and I think, didn't we have the first case of measles discovered recently in Vermont, or am I not remembering correctly?
No, I think you're right. I think it was in Lamoille County.
Yeah. So
You are correct.
Yeah. So, obviously, there are people that don't think that that vaccinations do much, and they certainly are welcome to their opinion. I respect everybody's choice, especially for themselves, to do or not do vaccinations. And of course, obviously since 2019, we've had COVID situation, which is a whole nother, ballywick, if you will. And I think most people that I know of did at least get the initial one. There's some disagreement about whether it makes sense to keep getting it, a vaccination every year. And then I had the other two. So I've had the vaccination against, what's the disease you get from measles? If it's kind of living inside your body and then it...
Shingles?
Yes.
Oh, shingles. That's from chickenpox.
Yeah, or chickenpox. So I did get that one. And then there's another one, a respiratory situation, RSV maybe. Yeah. So I got those 3 1 year, and I feel bad. I mean, I never got, so I didn't feel bad. I'm one of those maybe strange people that I can get a shot, and it never seems to affect me. The only thing it sometimes does, I get a little bit sore in my bicep area or my tricep area, but I don't have any other reaction to them. So anyway, that's just out there. But okay. We're talking to Dr. Megan Gunn, who's a pediatrician with the Red Clover Pediatrics offices in North Bennington. And she's also on the board of AHEC. I think you said you were the secretary too, correct?
Yes.
So what does that entail?
Oh, it's not a lot extra.
No? Okay.
We have bi-monthly board meetings, and I get to listen extra hard and take all the notes, which actually is good for me because it keeps me focused and listening.
Well, I bet it does, yeah. How many patients do you see in a normal week, Megan?
So that's an interesting question. I don't even know if you know this, but my practice now is actually very different than what I was doing a year ago. So I actually have the first direct primary care pediatric practice in Vermont. And just briefly, what that means is that my services aren't billed through insurance. It's kind of like a monthly membership almost, if you will. And then it's more personalized care, more time for patients, more timely care, and really direct access with me. So I don't see nearly as many patients as a typical pediatrician would. So that's kind of a, not unfair, but a biased question.
No, I understand. Do you think that model might catch on in other? You said you're the only one in the state offering that service. Do you imagine there are other pediatricians who look across and say, "Boy, that's a great idea. We could give, patients a much more comprehensive treatment plan if we're allowed to do it that way."
I hope so. I actually do. I mean, I obviously won't say who they are, but I do know a pediatrician in Vermont looking into it. And I think it originally started more in southern states, and so it's kind of gradually coming north. There certainly are other adult primary care, physicians that do that model in Vermont. And I think it's the wave of the future. I mean, I don't know how to fix the mess that I think healthcare and health insurance are now. And I think for a long time, I thought I was going to be able to fix it somehow, and I couldn't, obviously. So this was my answer to that, to be able to practice the way I really always wanted.
Yeah. We could probably do 4 or 5 shows on the current situation with healthcare. It has grown disproportionately in complexity, and it just is so hard for the average person to even find a healthcare provider right now, and then to pay for it. And it's one of those things where, our commercial insurers are dwindling. Blue Cross, Blue Shield, and MVP, I think right now in terms of healthcare, are the only 2 left. And I have a feeling that we're not going to see MVP renew their contract in Vermont. They have way more patients in New York. And I think we're going to be left with that one carrier, Blue Cross Blue Shield. And they're struggling if you look at their bottom line. So I don't know what the solution is, but It's not working very well right now. Peg, yeah, did you? Oh, okay.
No, I'm just listening, kind of taking it all in.
Okay.
But it does go back, though, to the whole idea of we need, people living in rural and underserved communities, they do not have the same access, as those of us maybe who live in larger towns and cities. And one of the things, just to go back to what AHEC does, because it made me think about it when Megan was talking about her rotations, is one of the things that we do is we bring health professionals into rural communities to see, how rural healthcare functions and what it's like to work in a rural hospital or a practice. And one of the statistics that emerged out of that is that students who have positive experiences in their communities, education experiences, are more likely to stay there, as professionals.
Sure.
So I'm hoping that will continue, and I know that AHEC plays a huge part in that. So
I think that's definitely true, and that's kind of what I was saying, is if we can educate them about these careers when they're young and hopefully then keep them within the community once they do get their training in whatever specialty it is.
One of the things, too, I think that's important that AHEC does is there's a lot of students are first generation. The parents have not gone to college. And so the opportunities for them are more limited. And part of what our goal is to make sure that these enrichment programs are available for all students. Everybody has a chance.
Yep. In many cases, I'm sure, and I don't want to pick on any area of the state, but there certainly are more rural areas in the state. For some of those, especially the younger patients, might be the first time they've ever seen a dentist. And again, if you intervene early and you get regular oral checks, you can avoid having to do work on the inside of the mouth in terms of cavities and unfortunately even losing a tooth or two. So, yeah, I think this is important. And since you mentioned 1971 is when AHEC, and by the way, again, that stands for Area Health Education Centers. That's when the U.S. Congress passed the first AHEC bill. And in Vermont, 1999 was the first one for Southern Vermont. It's now in 44 states. I don't know where the other, whatever the difference is, where they are. I don't know.
That's another good question. I'll have to ask Dwayne Harris, who's the president and CEO of the National AHEC organization.
If it's a national organization, you'd think people would want to join.
Well, you would think, but their membership is growing tremendously. Okay. In fact, I just did a podcast with Dwayne Harris and Nicole LaPointe, who is the executive director of Northern Vermont AHEC. And Dwayne was very quick to point out that our membership is growing. I think we have AHECs, I can't really pinpoint exactly where they're growing, but I know the memberships are growing because I think people are understanding there's a definite need for these types of organization, promote healthcare.
We're talking to Peg Bolgioni, who is in Rutland and works at the Rutland office of the Southern Vermont AHEC, and also Dr. Megan Gunn from the Red Clover Pediatrics offices in North Pennington. We're going to take our first break on the show, and we will be back with more of Catamount Community Connection in just a minute. Welcome back to Catamount Community Connection, our weekly public affairs program here at Catamount Radio. I'm Brian Collamore, your host each and every Sunday. And again, our program brought to you by the Rutland County Agricultural Society, which has brought you the Vermont State Fair at Rutland since 1846. This year's fair, the 179th. Or 78th, I guess it is, coming. No, it is the 79th, coming up August 12th through the 16th at the Vermont State Fair here at the fairgrounds in Rutland. And again, today we're talking with Peg Bolgioni, who works out of the Southern Vermont AHEC office, and that stands for Area Health Education Centers. And also on the phone with us is Dr. Megan Gunn, a pediatrician from North Bennington. And maybe I can get Megan, because you made a good point about how you got started in this. You were a high school student, And because of some illness that your dad encountered, it was sort of maybe a natural progression. You went to medical school at UVM, and I don't know how long you've been in North Bennington. You said you went to Rutland High School, but what made you stay in Vermont? You must have had opportunities, Megan, to go to other places where perhaps the economic reward would be greater. I'm thinking of more populated states, New York, Connecticut, that kind of thing. But you stayed in Vermont. How come?
Yeah, that's a really good question. And actually, going slightly back, I wanted to also highlight that other kind of benefits or things that I was involved in with AHEC through time was also the placement. When I was a medical student, when we're medical students at UVM, they place you in different primary care sites. And AHEC is involved with some of that connection and hooking students up so they can practice in these more rural communities. So I think that is one of the things that I'll get back to that helped me want to stay in Vermont. And then also the Vermont Educational Loan Repayment Program. That is a program where you can apply for loan repayment and you have to be practicing in Vermont. So that's another incentive there that I used from AHEC. But I've now been back in Vermont 12 years, actually, now. Right after my training, my residency, which was in Worcester, Mass, at UMass, I moved back here with my husband to Bennington, and we started a family. So I've been here in Bennington. And I think there's a lot of different reasons why we came back to Vermont. You're right. I had started thinking about jobs in Massachusetts where we were and definitely had some prospects, but we both from Rutland, so we wanted to kind of come back home and be in this, I don't like to say that small town feel. I'm doing air quotes. That sounds kind of cliche, but in Vermont, you're just all so connected because it is smaller. And so I know pediatricians that are up in northern Vermont, and we collaborate on a monthly, it was weekly at one point, but a monthly meeting. And I specifically remember when I called about my license in Vermont, when I first was moving here, I called the office thinking I was going to get a voicemail, and the person who picked up the phone was like, "Oh yes, Megan, I have your application right in front of me." And you just don't get those kinds of things in other places. And so I think we're really special in that way. I just love people of Vermont, and getting to practice here is really special.
Yeah. Many people that we talk to in the state legislature who have moved here or who have gone away and then come back, as is the case with you, do mention that sort of hometown feeling. I don't know how else to say that. I know exactly what you're talking about, where you can walk down the street and every other person you know. And that's not true in other places. So if you can arrange financially to make things work, I don't know what the price is to live in a state as beautiful as this in terms of the environment and being able to go out and enjoy it, or that sort of hometown feeling. But as long as you can make a buck enough to make it work, there's other places people can go, but I'm not so sure they'd be any happier, taking a train ride every day to work or getting on Route 128 in Massachusetts and, taking an hour to get to work, and you're in a traffic jam most of that time. So I do appreciate that. And I know for me, we appreciate that you stayed in Vermont. And Bennington's a great place, but, as you well know, Rutland's a nice town too. So maybe you at some point want to journey north a little bit, Megan. I don't know.
There are great pediatricians in Rutland who I also know, and they're amazing.
Okay. Peg, you wanted to mention some other things that AHEC's doing. We'll mention that medical event, that sort of, I don't know, for lack of a better term, event, but it's over at Castleton. But tell us about the C-SHIP program, too.
Oh, sure. Well, again, that's one of our pathway programs for students. This is designed for students on the college level, and it's a structured, part-time, non-clinical experiential learning program, and it's designed for Vermont students that are interested in pursuing, a health career or health-related field. And the internships are done over the summer. They're 100 hours. And the nice thing, Brian, is they're paid, which is unusual for internships. And most of them are remote or project-based, and a lot of them focus on community or public health. So we've had students work in hospitals. We've had them work in, free clinics. They've worked for Come Alive Outside. And the benefits is they just get that very valuable hands-on experience. They can apply their academic knowledge to a real-world setting, and it helps them define their career paths. And they learn about more rural communities and their challenges. So I think it's a huge plus for them. And a number of our C-SHIP students have gone on to, full-time careers in health. A lot of them we have one actually that's, I think, at UVM right now in medical school. So
okay.
It's kind of a natural progression for
Yeah.
them.
Megan, in your practice, are you seeing, I don't want to say new diseases, because that's probably not a good way to phrase it, but are there concerns about how things are changing for our younger patients throughout the state and the country?
I would say definitely. You had mentioned earlier, but measles is a real concern. I'm certainly not educated or prepared to talk on it in any huge detail. But like you had said earlier, obviously, I respect an individual's opinion on whether they choose to vaccinate or not. But really, it is. The reason it works is because it's called herd immunity. And so enough people have to be immune, which at this point is now you have to be vaccinated since we generally don't see wild measles anymore. And that's how it works for everyone if enough people are vaccinated. And so it's a balance, and it's a gentle tightrope walk between that individual understanding of what someone wants to do with their body, but also realizing that it really does affect everyone around you. So I think measles is something to be aware of, and I encourage people to reach out to their pediatrician or doctor to find out if they are protected.
Yeah, and again, it's a balancing act. It's you got to kind of walk the fence with it, especially in schools where. If a child has not been vaccinated against measles, that's okay, I guess, if the parents have chosen not to go that route. But the added complication is that you may be putting others who also have not been vaccinated at greater risk. The herd immunity number, if I'm remembering correctly, and I did spend 2 years on the Health and Welfare Committee, somewhere around 95% of the population, I think if you reach that level, you've satisfied that sort of herd immunity. Does that sound right?
That's correct for measles, definitely, yes.
Yeah. Okay.
And, that example you gave, there are some, for different reasons, some children that can't be vaccinated against measles. If you're under 1 year old, you're typically not vaccinated. If you have different sort of potentially cancers or other immune problems, so it's not always a choice. And that's why it's kind of really especially important to get to that 95%.
Yeah. I can remember I didn't have any choice about it when I was a youngster. My parents said, you are going to get vaccinated. And as I remember, it was maybe not one shot, but it was a shot that carried more than one vaccine. It seemed like there was like a whole bunch of little holes in your arm, not holes, but you could see the vaccination mark years later, but maybe it's different.
Oh, I know what you're talking about. It's not like that anymore. It's called a measles, mumps, rubella vaccine because those three are together, and there's no way to separate those out. But it is not, I know what you're talking about. It is not that, like, three-pronged one.
Yeah, that's the one I remember. And I can remember making a deal with my parents that if I did it, and I got two brothers and we all went at the same time, that I'd have a donut afterward. It was kind of like...
Oh, absolutely.
I had to make a deal in order to get it done. But again, I marvel at the fact that I can get that, and I never seem to have any reaction. So I kind of also wondered what was in that maybe it was water. I didn't, but I'm sure it wasn't.
It wasn't a placebo.
It is interesting, though.
Yeah.
I don't think we know enough about why some people have, I'm not going to call them reactions, but more negative side effects.
Yeah.
Really feeling crummy or a fever or stuff like that afterwards. I'm one of those lucky people, too, that I don't feel much after I get a vaccine. So I line up for every single one. I wouldn't preach getting them if I wasn't doing it myself.
Yeah, and that's an important consideration for sure.
Absolutely.
I don't know whether you have any time constraints, Megan. We'd love to have you stay with us for the full hour. We've got about 16 minutes left in the program today. I want to give Peg another shot at the talk about the Governor's Institute of Vermont and the event they have coming up. But you're welcome to chime in. We've got your mic open the whole time, so you can just interrupt us if you need to.
No, that's great. Go ahead, Peg.
Go ahead, Peg.
Okay.
Yep.
All right. Well, I wanted to put another plug in for the upcoming Health and Medicine Institute. The Governor's Institute is sponsoring this summer. And there's one up in northern Vermont at Vermont State University in Linden. And then, of course, that will be July 6th through the 12th. And then we are having one down here in the southern session, which is at Castleton, and that's July 13th through the 19th. And at these institutes, you will explore careers in health science, research and medicine. You'll practice hands-on medical skills like assessing vital signs and interviewing patients. You'll receive certifications, earn credentials to kickstart a career in medicine. And there's going to be a variety of hands-on lab activities and workshops led by health professionals and college faculty. And then a real bonus is working with medical students and from the University of Vermont College of Medicine. They're there all week. It's an overnight camp. And for those who are listening and interested in maybe having their children register, it's usually for sophomores, juniors, and seniors. And they go to giv.org. So,
is there a cost?
Hey, Peg.
There is a
That's what I was
cost.
gonna ask.
There is financial assistance available. So I would encourage those listening to just check it out and see what what they can or can't are able to manage. And I'm sure that there'll be some type of assistance.
Okay, yeah. Megan, you wanted to say something too?
Oh, I was going to ask how much it costs, but that just sounds so amazing. I did, correct me if I'm wrong, Peg, but it's sort of a different iteration of that years ago when I was the counselor. So that was a thing called MedQuest that then my understanding, so back then it was a full week or 5 days at least. And it was, they slept over. I think we had it back at the College of St. Joe's back then in Rutland. But I think that kind of maybe fell out of favor and it was not an overnight anymore. Correct, Peg?
Yeah, the more recently, the last couple of years, we modified the program so it was a day camp. We made it,
right.
It was 3 days, pretty intense. We had it at Rutland Regional Medical Center, and the kids did kind of a more of a truncated version of what they would do over at the GIV Institute. They did job shadows. There were all kinds of folks from Rutland Regional Medical Center representing all kinds of careers, so they did panel discussions. The students did some simulations, so it was a very busy but very fruitful week, 3 days, I should say, for them. But this year, last couple of years, we've been doing a partnership with Governor's Institute of Vermont. So
go ahead, Mike. And it just sounds so great. Like I would have loved to participate in that. It sounds like it's really come a long way, and I especially like the fact that they get real certifications. I mean, they can really use that. There might be someone choking that they actually use that, or CPR. I mean, that's awesome. I think it's really, really great to give them that experience and training at the high school level.
Oh, definitely. And they can put those on their resume, when they...
Yeah. When is the deadline for that application? When's
the deadline, Peg, for that?
The deadline is, I believe, this month, but as I said, just go to giv.org. And there'll be information that's available.
And that would stand for Governor's Institute
of Vermont,
GIV.org.
Correct.
And you'll get the cost shown there and probably a little synopsis of what the sophomores, juniors, and seniors would go through. And so this is a pretty exciting thing. And we may be able to find some new folks who have, up until that point, never thought about a health occupation for themselves. But as is true with Megan, you never know. You just, you're exposed to so much. I can remember, and I've been in broadcasting for a while, so we used to go to Rutland High School and MSJ here in Rutland, and we would talk about a career in radio. And I don't know whether we ever convinced anybody to do it, but it was fun to do. And But there would be carpenters there. There would be lawyers. There would be librarians. I mean, the list of. So this is great that it focuses on health careers, and I bet you're going to get a pretty good turnout for that, and I hope so, because I know that we need more folks working in our healthcare occupations for sure.
Oh, without a doubt, Brian. And these are just one of numerous programs that are out there that we're trying to promote, in the schools. And I know that when we go into schools too, we try to do more hands-on activities, not just lecture the students. It's really about hands-on demonstration. Kids like to see and feel, touch. Try things, and I think that gets them more engaged. In the process.
I'm probably using a bad term here, but are there like dummies that they work on?
Yeah. I mean,
okay.
I agree with you.
I'm sure there's a better term for that.
That's not a good. That's not the best term. But I do. Yes, when they're doing CPR, for example, or they're doing compressions, they have to work on mannequins. That's
mannequins. That's the
mannequins.
Word. Yeah. Sorry. Okay, and it's funny you mentioned the bleeding, the Stop the Bleed. Mm-hmm. In the legislature, each committee had to pick someone in the committee, and there's 5 of us on the Senate Agriculture Committee, and I just raised my hand and said I'd do it. So we have training on Stop the Bleed, and also, as you said, unfortunately, if there's a shooter, we need to know where to go and count number of people that were with us so that they can report back. And it really was a eye-opening experience for me to realize that I could really literally save somebody's life if I knew the right thing to do. If I had the wrong thing, then that wasn't much use. But there's ways to do it, and that's really great. So you've got doctors and nurses and techs and also teachers all involved with this, right?
You mean with the Health and Medicine
Yeah.
Institute? Yes. We have folks from Castleton, faculty members that are there presenting. And then we bring in folks from the outside, from hospitals or private practice or nonprofits to do presentations for the students. And again, we try to make it as interactive as possible, so it engages them much, much more. I did want to put a plug in too for AHEC Week, Brian. We're going to be at the State House
this coming week.
On the 26th. We're going to be there. It's AHEC Day at the Vermont State House. We'll be in the card room. And our 2 executive directors from North and South AHECs will be there, plus someone from the Office of Primary Care. And they're going to be there with table, answering questions, advocating, of course, with legislators. So we're pretty excited. I'll actually be up there that day, too. So,
okay. Yeah. Well, I will see you there for sure.
That's right. Yeah.
Megan, have you got anything? We have about 5 minutes left, so I just wanted to leave a little bit of time at the end to have you talk about anything else we didn't mention. If you choose to.
Anything else specific that you think I should highlight, Peg? I want to make sure I hit all the points.
She was saying, I had your mic off for a second. Anything else that you think Megan ought to bring up?
Well, actually, Megan, I think what folks might be interested in hearing is, I know you're a parent as well as a physician, and if you if you had a child that was interested in health careers or even just remotely thinking about it, what would you suggest to them as a way of learning more and preparing?
Yeah, I think, I'm off mute. Thank you. Sorry, I just wanted to check. I think as a parent who's supporting a child that's looking into health careers, a few things is important to remember. It is not, I think a lot of people think it's like doctor or nurse or a physical therapist or nothing. And there's a lot of things in between there and requires different levels of education, different durations of education. There's really an option for anybody that's interested in some part of healthcare. I really believe that. And then I think exposure is going to be the next most important thing. So by the programs that come out to the middle schools and high schools, when the roadshow, that's the word you used, when Amanda goes in and talks about the different career options there, and also the opportunities like Governor's Institute, just to get the exposure is really, really important. I think those would be my biggest recommendations.
Okay. Well,
Well said.
Yeah, those make total sense to me. I'm trying to think of, I don't want to say obscure, but maybe a career that a lot of people don't think about, but has a direct relationship with healthcare. Someone must be in charge of coding different sort of procedures to get reimbursement back. And again, it's probably not something that everybody would find pleasurable work, but it's probably something that a lot of people need, especially in our healthcare facilities, in our hospitals. And I just pick on that as sort of something that maybe it's not a terribly romantic kind of idea to get, but it's a crucial occupation, I would think. And I don't know, are you doing your own? Well, you've got a little bit different situation, Megan, but for instance, the hospitals have to go through, and we tried to simplify this last year. To be fair, the insurance companies weren't jumping up and down about it. They didn't want the bill to pass, but we tried to at least make it easier, especially for a medical professional, to not spend any more time than necessary behind a desk and a computer trying to figure out what the right code was for this procedure in order to get reimbursed. It did go through, and I got a lot of thank yous from doctors, but there's got to be somebody in the offices all the time that they're doing that work, right?
Oh, absolutely. That's a great example of a job that's in healthcare, not necessarily hands-on. Having good coders is really, really vital when you're doing anything through insurance, because it's, like you said, kudos to the work that's been done, but it's still very complicated.
Yeah,
so
if
that's
I could just jump in real quickly, Brian.
Sure.
A lot of another important demographic that I think the health career world is targeting are adults, people that want to change careers, or maybe just pursue something totally different than what they've been doing. And I know that there's a lot of discussion going on right now with hospitals and with providers about providing programs that can on-ramp people into these positions, something that's low cost, no cost. And the important thing is you have to be innovative, and you have to know how to train these people in the right way so they'll stick with it. But it also has to be affordable.
Yeah. I would expect, I'm trying to think, if there are seniors who are listening that maybe have stepped away from what they did for the great majority of their life, but are very interested in staying with something like this, that there might be a path forward for them to, I don't want to say necessarily volunteer, because they're going to get paid at some point too, probably. But, all too often we talk about our younger folks, and those are the important ones. We want to sort of get them interested in a career right away. And then once people get into their earning years, whatever that is, 25 to 54 or whatever, but there has to be a bunch of people, and let's face it, we're all living a lot longer. There have to be a bunch of senior type folks who might benefit too, right?
I agree. Yeah, absolutely.
Oh, I'm
I think
sure
hospitals are trying to work on that.
Okay.
That's sort of a strategic part of their, I think, strategic plan is to be able to recruit these people to come back into the workforce at some point. And it's not just coding, but it's phlebotomy. And a lot of the tech centers offer these programs too.
Go ahead, Meg.
Yeah, even someone that maybe hadn't been involved in healthcare, I know there's a lot of different, and I don't know all of them, but there's different types of tech. So there's like a phlebotomy tech. I had an older patient for me. She was early 20s, and she was a dialysis tech. I didn't even know that was a thing. I will be honest about that. So there's a lot of those things that, I think some people might retire or semi-retire and then realize they still want to or need to work. And so I think there's probably great programs out there to change it up and go back to one of the tech centers or through the hospitals and get training.
Yeah, I mean, I don't know if we're reaching any former Indy 500 race car drivers who now want to make a change.
But be phlebotomists.
Yeah, it could be something that you never thought about before, and all of a sudden, geez, that sounds pretty interesting. Mm-hmm. Maybe I'll review that. Can they go to this event over at Castleton, or is strictly for
this is strictly for high school students. But they might want to keep their eyes out for local career fairs, job fairs, because I know the hospitals are all very well represented at these events.
For sure.
So,
Well, Megan, it's been a pleasure having you on.
Thank you so much for having me.
Yeah, no, it's been great, and best of continued success to you and Red Clover Pediatrics in North Bennington. Are you able to take on any new patients?
Oh, absolutely. I just opened in August, so I'm still taking new patients. And if anyone wants information, they can go to redcloverpediatrics.com.
Okay, great. Well,
Thanks.
I want to give Peg the last sort of minute or two here. Is there anything we haven't talked about? It's AHEC, National AHEC Week this coming week. Peg will be up at the State House on Wednesday, and they'll be in the card room, which is that little room before you get to the cafeteria. That's the National AHEC Week. We talked about the Governor's Institute of Health of Vermont, and the medical event. It's coming up at Castleton, July 13th through the 19th. We talked about the C-SHIP program. Is there anything else you wanted to let us know about today?
No. As I said, we're working very hard to just create these innovative, interesting programs, these pathways for students, so they can learn and grow and maybe satisfy their curiosity about healthcare. And, we appreciate all the supports that we get from the schools and from the state and the feds, for allowing us to continue these programs. They're very important and needed.
Yeah. And I know, as is true with everything else in our world, great uncertainty at the federal level about kind of the next thing that's going to happen here. It's unfortunate, but there's not much we can do about that in Vermont. And so we are crossing our fingers that we're not going to be deeply affected by any cuts, but that remains to be seen, and we'll do our best to take care of as many people as we can. So anyway, there you go. So my thanks to Peg Bolgioni, who is the working out of the Rutland office of AHEC, again, Area Health Education Centers, and also Dr. Megan Gunn, who is taking on new patients at the Red Clover Pediatric office in North Bennington. And again, we appreciate folks listening and letting us know that they are listening. It's always gratifying to me to hear somebody walk up and say, "Hey, I heard your show on Sunday there. That's a good show." Or, "Hey, can I get on that show?" That kind of thing. So there we go. And we will let it go for the moment. We will see all of you, or listen to all of you, hopefully, next Sunday on Catamount Community Connection.
Thanks, Brian.